Hi guys, in this video I will be covering the situational judgment and how to approach each type of questions in the situational judgment section. So let's begin. So there are a few things that you should always be considering. The first one is the patient safety, second the patient confidentiality, third data handling. These are the most important things that you should be considering. And then moving on, there are policies. It can be university or the hospital policies, the feelings of patients or the colleagues or yourself, learning opportunities, exploring patients' concerns. This is very important, and incorrect information, as well as considering your own health. So not just patient's health, but your own health as well. All right, so moving on to the first example. In this, we've been told that Peter, who is a third-year medical student, is on a placement, and he has his consultant who asks him if he would like to observe a rare surgery which he is about to perform. And it says that it's a great opportunity for Peter to further his education. And however, it's been told that he's due to have dinner with his parents who are in town for the night, and Peter hasn't seen them in a while and doesn't want to cancel if avoidable. So in this case, we've been asked how important each of these things are going to take into consideration, and the question is that the surgery is rare and he might not have the opportunity to see it again in a while. So in this case, what should come to mind is learning opportunities. You won't get the same opportunity in a while, but you can reschedule the dinner with your parents for a later date or later time. So that's why this should be very important. Right, moving on to the next one. It says that Rory has been working on a funding proposal for a youth, and the deadline is tomorrow, but the other volunteers, Sam, has not completed their section, and it asks how important are each of these. So in this case, the question is asking that Sam recently had a bereavement in her family. So in this case, what should be coming into your mind is feelings. You should be compassionate towards other patients, your colleagues, and also your peers at uni. So in this case, that should be very important because you should be considering others' feelings. But this is only important because of the situation, as Sam might need help. But in other situations, for example, we've been told that the one of the students, Margaret, is interrupting the lecturer and asking irrelevant questions, and the lecturer is getting flustered, and Margaret is finding this amusing and is laughing with friends and lectures being discomforted. And one of the other students at the class lecture, Jeremy, is finding it difficult to concentrate, and the interruptions are affecting his ability to learn. And in this case, you've been asked how important are each of these to take into consideration, and we've been asked about Margaret's feeling. So, well, last time it was very important, but looking at this scenario, this specific scenario, the main focus, the main thing we should be concerned about is the learning of yourself as you are Jeremy, and also the learning of the other peers, as well as your lecturer discomfort. And in this case, because Margaret's interrupting the lecture, and even if she gets annoyed at you asking her to stop, her feelings are not as important as learning of yours and others. That's why this should be not important at all. Alright, so moving on to the next example, we've been told that Cameron, who's a fourth-year medical student, is working with oncology consultant, and as they're about to discuss test results with the patient, Miss Smith, the consultant is called away and to another ward. And Miss Smith, who is the patient, is very distressed and anxious about the results. And so it's asking how appropriate are each of these, and it asks to tell Miss Smith not to worry about the results. But normally what you're doing is you're reassuring the patient. You're trying to make sure that they're not feeling very scared, they're feeling all right. But in this case, telling Miss Smith not to worry about the results, what it's doing is giving potentially incorrect information. Well, not to worry about the results. She might have a terminal illness, or maybe something very distressing, and telling not to worry about the results, and she might think that nothing's wrong, and this might lead to potentially the patient thinking that they're absolutely fine, and then when they get the news, it will be even more heartbreaking. So that's why, even though you try to reassure them, it's not appropriate. It's a very inappropriate thing to do. Well, usually reassuring is a very good thing to do, but in this case, it would be a very inappropriate thing to do. Right, so in this example, we've been told that Dr. Jacobs is a GP who is visited by a patient, Mr. Matthews, who is he previously referred to a stop smoking group to help him stop smoking. And during the consultation, Mr. Matthews tells Dr. Jacob that he's never attended the group but still wants to stop smoking, and how important to take into account the following considerations. And the first and what it's asking is why Mr. Matthews did not attend the group. Now, this might sound confrontational, this might sound a bit rude, but this is very appropriate because you're exploring the patient concerns. If you do not ask Mr. Jacobs, you might feel like he might feel bad about telling you, and you might not want to ask to make him feel bad. But it's so important to explore patient concerns, because there might be something that's concerning him, and you might be able to find a alternative solution which might be better. So unless you ask the patient, you'll never be able to find out what's concerning him or her. So that's why it's very important that you explore the patient concerns, and asking why they did not do something is a very good way to go ahead. And that's why this should be very important. Alright, so in this scenario, we're being told that during a routine ward round, the junior doctor, Alfonso, notices an irregularity in the patient notes. And the consultant suggests that Alfonso to backdate the record to correct the irregularity. And we're just being asked how important to take into account the following considerations. Right now, the statements, it's saying the hospital policy does not condone backdating. Now, as soon as you see hospital policy, you should be thinking of policy, and policies are always very important. It doesn't matter, it can be hospital or it can be university or college, whatever it is, policies are always very important, and that's why it should be a very important consideration to take into account. Alright, so the next question states that Adam is on a work experience placement shadowing a GP in a large practice. The next patient walks into the consulting room, and Adam realizes that it is the mother of one of his friends. Now, how important are each of the considerations for Adam to take? So it states that the patient does not recognize who Adam is and has consented to having a work experience student in the room beforehand. Now, in this case, what you should be thinking of is patient confidentiality. Now, even though the patient does not know who Adam is, Adam does know who the patient is. So Adam should make sure that he's not there when the patient is addressing her concerns, because it might be something serious, and it might cause Adam to tell that to his friend, and that will be breaking patient confidentiality. So the patient does not recognize who Adam is. It's not important at all. Patient confidentiality is the main priority, so that should be the first thing that Adam considers, not that the patient does not know who Adam is. Alright, so now the next question states that Peter, who is a qualified FY1 doctor, is adapting to a busy schedule at the hospital, and the consultant who he's working with enjoys challenging him by giving him lots of different responsibilities around the hospital. And Peter has been managing that really well for the past couple of weeks, However, recently he has been feeling exceptionally tired because all the work has caught up to him and he's not feeling himself and he feels very run down. So the question states that how appropriate are each of these to take into account. Now it states that Peter should continue as not to disappoint the consultant. So in this case, what you should be thinking of is Peter's own health. So if he continues, this could deteriorate his own health as well as the health. It can impact the patient's. So that could be a very bad thing for the patient safety. So that's why in this case, continuing would be a very inappropriate thing to do because it will have fatal consequences. Alright, so this question states that Dr. Khanna is a dentist working in a local practice. He is visited for the third time by an elderly patient, Miss Yates, who repeatedly complains of bleeding gums. On previous visits, she has been given mouthwash to use to prevent this and to prevent further gum disease, but she's not been using it. And how important are each of these considerations to take into account? So why Miss Yates has not been using the mouthwash prescribed? So in this case, again, what you should be thinking of is that this statement is exploring the patient's concerns. And when you're doing that, that's very important because you will find what's causing the patient to not use it. And therefore you can find an alternative solution which will probably be better, and the patient would follow that hopefully, and therefore you need to know what's causing the problem and therefore you can address the problem. So that's why exploring patient concern is very important. Right, so the last example states that Ellie is a first year medical student and is very excited to have been accepted on a course. And she's about to start the visiting hospital, so the occupational health service at uni have asked her to disclose any health issues that she may have to them. And Ellie knows that she has a rare blood disorder, but she does not want anyone to know about it. And how important are each of these considerations to take into account? And it states that if an accident occurs while she is in the hospital, her blood disorder may be a serious risk to patients. So in this case, what you should be thinking about is patient safety. So patient safety is very important. It is one of the most important factors as a medical student or a doctor. And the fact that they're saying that Ellie knows that she has a rare blood disorder and she does not want anyone to know about it is a distractor. It's distracting you from the main thing, which is patient safety. So you should be forgetting that, and as soon as you think that, oh, patient safety might be concerned, it's very important.